Good morning, everyone. I am Dr. Arjun Arya. I am a consultant psychiatrist practicing in the Tri-City for the last 15 years. And before that, I was working in Mumbai as a consultant at Masina Hospital and Grand Medical College, Mumbai. I came to the city in 2008 and started this licensed hospital. Arya Hospital Neuropsychiatry and Trauma Center is the first and the only licensed psychiatry hospital in the Tri-City. Dear friends, I am going to talk about a very important topic which we all are facing in the cities of Punjab, Haryana, Himachal and especially North India. The problem of drug addiction, is not only prevalent in our India in the northern states, but we have the entire India and a global problem of drug addiction. How do we tackle drug addiction? I will be talking about brief points and how to go about it. First of all, what is drug addiction? Please understand, drug addiction is a neuropsychological disorder which not only affects our brain, but it also affects our body. We have so many people coming to us talking about addiction, whether addiction is a behavior, it is a obsessive compulsive disorder. You see a person who repeatedly has an intense craving, desire and fulfills all the criteria for dependence for over a period of few months qualifies for dependence. That means he is dependent on alcohol, on the drug, on smoking, on so many other drugs which people come to. Many people do not understand where to go. They will always ask us which centers are there or which rehabilitations. Dear friends, you should know that first and foremost, we should take the patient to the hospital, should be evaluated by a qualified psychiatrist, psychologist and a social worker. These are the three people who are involved in treating drug addiction. Today I am going to talk about the various forms of drug addiction prevalent in our Tri-City. I cannot give you the exact data, but there are a number of patients which are coming from the neighboring states of Himachal and Haryana for drug addiction. That means that are these people not treated over there? Now that is the question. I would like to tell you, many people will ask on phone whether what is your treatment, how it is done, how alcohol is done, how treatment for opium is done, heroin is done, cocaine is done, cannabis is done, and then we have people who abuse medicines which are produced, which are basically tranquilizers and sedatives. Talking about alcohol, you see that every person who is dependent on alcohol has to be detoxified for 5 to 7 days. It is not a time frame which is important. What is important is that to take out the person with a safe withdrawal, a physical withdrawal, a psychological withdrawal, and that has to be done an inpatient. It cannot be done on an OPD basis. So the patient is admitted with us after a formal evaluation. All his tests are necessary, blood test, his necessary EEG and psychological is done, and he is admitted for a period of 15 to 20 days, which after detoxification is the role of the psychologist who will evaluate that why the person goes into alcohol or opium again and again, whether it is a dependence problem, it is a behavior problem, it is the dependence has occurred because of depression, which is very common in people who start drinking or they start abusing heroin, or whether it is some kind of a behavior or a personality issue or some conflict with the family members. That is why the person has gone into addiction. Now what we do here is we provide comfortable stay to the patient along with the relatives of a time frame which is evaluated depending upon the psychiatrist's opinion, psychologist and a social worker. All three mental health professionals work here in this hospital providing care which is utmost important for the person to have a safe and effective withdrawal, and the patient comes out of the withdrawal. After the patient is out of withdrawal and the other threatening complications are taken care of, we engage the person in psychotherapy and psychological evaluation, trying to find out why this person is going into alcohol again and again. Dear friends, please note that all this treatment is not done in a rehabilitation center. It has to be done in a hospital setting which is safe and which is done by medically qualified psychiatrists and psychologists. Yes, once the person has been diagnosed, he has been treated, and there is no chance that the person will behave abstinent in the society, he has to be referred to a rehabilitation center where he has to be kept for a period of time, where the certain skills can be taught to the person that he can go back to the community. I have lot of patients which are not only suffering from alcoholism or alcohol dependence or heroin. We have certain people coming from cannabis also. Now, cannabis is another problem which is very prevalent in Himachal, and certain teenagers, they basically engage into, because cannabis is a gateway drug and few countries have legalized it, but it has not been legalized in India. And teenagers who basically engage in cannabis should understand that it has a life-threatening psychotic problem. A person can become schizophrenic after regular use of drugs like cocaine, cannabis, meth and other drugs. I will advise teenagers to do physical activity as far as possible and stay away from drugs, because that is the need of the hour. The youth of today is the adult of tomorrow, So we should not forget that drug addiction not only involves the human being, it involves the family members, it involves the society at large. And at what price the family is paying to get the person treated should be kept in mind. It's a comprehensive approach wherein the role of a psychiatrist, psychologist and social worker should be taken in account. It is not only to get treatment done. After the treatment, the patient should follow up with the psychiatrist for 1 year, as well as for counseling and family therapy, which is to be done by the social worker. I pledge to make our Tri-City drug free by engaging in several open camps which are free of cost, which we are doing at various associations with certain non-governmental organizations. And I feel that we should sensitize this topic as far as possible and incorporate in our schools and colleges, educating the youth such that they stay away from drugs. Dear friends, as you know that certain people, they basically do alcohol, they do cannabis, they do opium. One should keep in mind that the drugs which are available, we should help in getting the drug peddlers arrested as soon as possible to stop the menace of these drugs in our society. And secondly, we should get ourselves evaluated with the form of a psychological evaluation, which is done by a qualified psychologist at a hospital setting. That if a person is suffering from stress, he would come to a hospital, and a person wants to relieve his stress. Teenagers want to get away from stress by drinking alcohol or by taking in drug. That is the first time where for stress we should not take alcohol or other these drugs, but we should consult a psychologist, such that through counseling a person is able to understand his problem or increase his coping mechanism such that he can go back to normalcy. Once the person gets habituated and he feels the need to take the alcohol again and again, that is where the problem lies. And a person, instead of going to a psychologist, he sits with his friends and eventually gets into the vicious cycle of alcoholism or drug dependence. So friends, remember that psychologists are normal people like you, and they will address your problem, they will sit with you, they will work out the stress problem, and such that you do not get into the vicious cycle of dependence. So please meet psychologists and social workers. Thank you.